This is a clinical analysis of Jack in Fight Club by Laurel Boatright, Kelsey, Shao, and Kenneth Nguyen.
The narrator of the movie Fight Club refers to himself as Jack until the end when he realizes that he has adopted another personality under the name of Tyler Durden. In the daytime, the narrator works a typical office job and attends support groups. However, in the evening, he hosts Fight Club in his basement where people of all different lifestyles come together and fight each other while promising to follow the first rule of Fight Club, to never talk about Fight Club. We diagnose Jack with dissociative identity disorder, which is when a person exhibits two or more identities or personalities. This causes extreme gaps in memory, consciousness, or identity. It is under the dissociative category for DSM-V. One symptom of this disorder is two or more distinct identities, which is exemplified through Jack's personality in the daytime, where he works in an office, and Jack in the evening when he becomes Tyler Durden. Another symptom is amnesia, which Jack experiences when he does not remember working on Project Mayhem or starting fight clubs in many cities.
While not necessarily a symptom, Fight Club's portrayal of Jack misses one key element of dissociative identity disorder. The disorder typically arises in response to a significant childhood trauma as a defense mechanism. The movie never shows this and leads the audience to assume his disorder was caused by his anxiety and by the fact that he feels isolated and trapped by the society he lives in. Jack's plan for treatment includes cognitive behavioral therapy. The ultimate goal of this is for Jack to eventually understand the root of his disorder and learn new coping mechanisms to deal with stressful or traumatic circumstances. This is the best course of action because there is no clear biological cause for dissociative identity disorder, so medication to directly treat the disorder would not be effective. However, medication could be prescribed in conjunction with the psychotherapy in order to treat any anxiety or depression-related symptoms. Furthermore, there are not as many ethical concerns associated with psychotherapy as with other treatments. The main ethical problem of cognitive behavioral therapy lies with the practice of rational emotive behavioral therapy, which is sometimes too forceful of an approach.
There are certain parts of the film where they are able to portray these dissociative identity disorder accurately, while other parts were imprecise. One part they got right for this disorder is when the narrator uses Tyler Durden personality as a facade throughout the film. As a result for using Tyler Durden as a coping mechanism, he has anxiety, insomnia, and became socially impaired. The film portrays the narrator as violent due to his disorder, which is inaccurate. Many people who truly have the disorder despise it when the media pairs the disorder with violence. Although the dissociative identity disorder was once seen as an American or Western phenomenon, it has actually been found in countries all around the world. Culture, influences, and knowledge barriers may affect how the disorder is presented or diagnosed in different parts of the world. In our culture, the media likes to portray the disorder as violent and has an identity that has dark desires and criminal